Can degenerative disc disease be reversed? That's a big question and one that often is not answered by most health professionals. In this video, we're not only going to answer whether or not degenerative disc disease can be reversed, we'll help you discover exactly what's going on, the best way to deal with degenerative disc disease, and what reversal actually means so that you can get back to the life that you deserve. Please stay to the end where we'll uncover one of the biggest mistakes people make when dealing with degenerative disc disease. Hi, I'm Dr. John Zielonka. I am the founder of the Center for Non-Surgical Regeneration. I have passed the rehabilitation program at the Ottawa Sports Science Center. I have been practicing in Ottawa, Ontario, Canada for the past 35 years as an award-winning neurofunctional chiropractor, where I've laid my hands on hundreds of thousands of spines. And I'm also the author of the bestseller, Low Back Pain is Not a Life Sentence. If you've been diagnosed with degenerative disc disease, you've most likely been told there is nothing you can do, it's inevitable with age. We're going to tell you that that's not true. In a lot of cases, this can be debilitating. It can affect all aspects of your health, your ability to walk, to pick up your grandkids, to do your job, et cetera, et cetera. And it will, in fact, even affect your mental health as well. I'm here to tell you that it's not your fault. So what exactly then is degenerative disc disease? Well, whether I use the terms degenerative disc disease, degenerative joint disease, spinal decay, spinal deterioration, or osteoarthritis, they all mean the exact same thing. Let me show you here on the models. So again, what we want to see, normal, you have a vertebrae, you have a nice thick disc, you would have another vertebrae. The thicker that disc, the more normal that disc is, the more room for the nerve to exit, and that's what we want. We want these nerves to exit so that they're not being pinched, compressed, anything like that. What happens is the stage one is you'll actually start to see that the disc itself thins out. It actually starts to wear out. When it wears out too much, the body will actually start to grow what we call spurs or osteophytes. That's actually bone that it's trying to grow. And you think, well, why would it do that? It's doing that because it's actually trying to fuse the vertebrae together, because it thinks, well, what it's doing is it's trying to make the best of a bad situation. It figures if I can fuse the vertebrae together, then the vertebrae can't move anymore relative to one another. So they're going to put less pressure on the nerve. The problem is all that happens is then it means you've got permanent pressure on that nerve as well, and you also lose normal movement and function, which then means the vertebrae above is going to happen, the same thing's going to happen to it, the vertebrae below, same thing to it as well. So that's what we don't want. What a lot of people don't understand, because a lot of doctors don't understand this, is a lot of people think that this is inevitable with aging. This is not inevitable with aging. There are three things that speed up this degeneration, and if we think about it, it's all common sense. Number one, this is a wear and tear. So number one, if we damage that disc, it's going to wear and tear faster. Okay? Very, very common sense. That damage can be what I call fast damage or slow damage. So fast damage is going to be your car accidents, your sports injuries, any type of injury and so forth. Slow damage is going to be that chronic work posture, those postural abnormalities, where it's a much smaller amount of pressure, but it's over a prolonged period of time. The second thing that speeds up this degeneration is a lack of movement to the area. And the reason for that is, I'm sure you understand that it's your bloodstream that takes nutrients everywhere in the body. Well, the one place blood vessels don't go, they don't go inside a disc. So the way that the disc gets its nutrients is a big fancy process called imbibition. What that means is you need movement to actually pump those nutrients into the disc, but the movement has to be specific to each individual disc. You'll say, well, I'll just turn my neck, and if I do that, then I'm moving and that's going to pump nutrients. No, you may, when I turn my neck, I may have two vertebrae that aren't moving at all relative to one another. And so you're not pumping any nutrients into that disc. And then the third thing is really the only one that is somewhat age related, because that's the other thing. People are led to believe this is inevitable with age and there's nothing you can do about it. That's simply not true. The third thing is the body's capable of producing the nutrients that actually build those discs. It stops doing that about age 40 or so. So you need to supplement. I had a patient just last week in my office who said they didn't believe in supplements. And you can have any belief you want. The problem is it's not going to change what's actually going to happen in your body regardless of that belief. So if you understand three things cause that, if we do things to actually counteract those three things, we can often see big changes. Most people don't. Most people just let it fester on its own, and that's exactly what we do, fester on its own. And they have no idea just how serious some injuries can actually speed up this type of degeneration. So for instance, if you've been in a car accident, even if you walked away from this car accident, on average, you've actually sped up degeneration in your spine by about 10 years. And it was a great study out of Cambridge University. You only need to be going 8.2 miles per hour or faster to actually create some significant changes in there. Obviously, we need to do the things that stop that degeneration in there. So can this be reversed? Well, here's the thing. I'm not here to give you opinion. I'm not here to give you what people believe. I'm here to tell you what the science actually says. We've known for years that through proper treatment, you can not only stop that degeneration, in a lot of cases, you can actually reverse that. The best science, the best clinical studies show that you can often get back a millimeter of disc height in there. Now, I know that may not seem like a lot to you, but every extra millimeter makes a huge difference. When we talk about reversing or curing, you're not going to go from bone on bone to magically having, 2 millimeters of disc height in there and so forth. Every millimeter makes a difference. And our particular clinic here, with the techniques that we use and the healthcare technology we use, we often see more than that. Again, no one can ever guarantee this. No one can ever, promise you a cure and so forth. But the best clinical research shows that degenerative disc disease actually can be reversed, provided you're doing the proper treatment. We have a number of case studies where we've seen that in our clinic, where we've literally pre and post x-ray, you actually see an increase in disc height. So then what is the biggest mistake? Well, we've talked about this before. The biggest mistake is not getting to all the underlying causes that are actually creating that degeneration and not taking an approach that then addresses that, let alone not even understanding that those things can be addressed. If you are stretching muscles, if you are strengthening the muscles, that's not going to stop degeneration. If you are taking painkillers or anti-inflammatories, that's not going to stop degeneration. You've got to be careful with some of the shots that are out there. I know there are new advances all the time, and once they've proven that some of these shots actually work, that's fantastic. But for right now, be careful. A lot of those injections, cortisone at best is a 50-50, and it's not going to stop degeneration. It's going to, basically try to kill the inflammation and kill the pain. But 50-50 at best, and what they often don't tell you is over time, it will actually weaken the tissue. And there you need treatment that is going to be specific to actually pulling fluids and nutrients back in the disc. A disc should be 86% water, and simply drinking more water does not magically rehydrate the disc. Again, that's what non-surgical robotic laser spinal decompression does. That's what we use in our office. Only 12 clinics in the world that use this advanced healthcare technology. And by creating negative pressure in the disc, you will actually get that vacuum effect that pulls fluids and nutrients back in. For a lot of patients, they'll actually see an increase in disc height, which is interesting because most people really don't do anything about their backs and their spines until they're in significant pain, until they actually can't do the things they want to do. And the truth is, why would the whole world not want to prevent discs from degenerating if they could, and to also even increase disc height in some cases as well. Now, if you're finding this information valuable, please share, please like, please hit that subscribe button so that then you get this type of information. If you live in the Ottawa area or anywhere close and you're interested in non-surgical robotic laser spinal decompression, again, please call us 613-688-1036. It all starts with an exam. The next video that we're doing is specific to whether spinal stenosis can actually be cured.